The skill I'm going to perform is for an IM injection, which is an intramuscular. The first thing you would do is check the client's record to be sure that the site hasn't previously been used that you're going to give the injection on, because you should rotate sites every time. So you would check the doctor's order for what the medication you're going to give is. So in this case, we're going to be giving a flu shot to Danielle. So first, I would take the prepared medication to the client's room, and normally these come pre-filled, so this is a pre-filled syringe. And you would check the bed number against the MAR that's on the computer. An IM injection, you should use a 1 to 5 milliliter syringe, and the needle gauge should be appropriate for the site that you're going to give the injection on. So for this case, we're going to do a deltoid injection, and that requires a 23 to 25 gauge needle and a 5/8 to an inch length. So when I go into the room, I would check the client's name band and have her state her name and date of birth.
Danielle Carpenter, 6/21/92.
Okay. And then I'm going to explain the procedure to her. So today I'm going to give you a flu shot, and I'm just going to put it into your deltoid muscle. And then I would provide privacy and close the door or the curtain. So first I would wash my hands and then put my gloves on. The deltoid injection site is located in the area 2 fingers below the acromion process and between the anterior axillary fold. So here's Danielle's acromion process. So I would have to give it in between here. So I would pull the skin tightly and then insert the needle quickly and at a 90-degree angle. So I'm going to do that to my arm. Okay, so I'm going to inject this into the orange in a circular motion. And then take the needle and you would spread the skin tightly and insert quickly at a 90-degree angle. And then you slowly would pull back the plunger and see if there's a blood return. If there is, you would have to discard the needle and prepare a new injection. If not, you can go ahead and give your injection. So you just inject really slowly. And then you just pull the needle straight out. You activate the safety device. And this would be discarded into the biohazard container. Then I would take off my gloves, wash my hands again, and then you would chart the medication by documenting the medication that was given and the site that you used. The next skill I'm going to demonstrate is how to put on and take off a PPE. So first you would do this by putting on the gown. So you would hold it by the shoulders and slip your arms into the sleeves. And then first you would tie the neck. And then fasten the ties around the waist. And the front of the gown is considered contaminated as soon as you enter the patient's room. So you just have to remember that. And then next you would put on the face mask. And then you make sure you pinch around the nose so that it fits tightly. Next, you would put on a face shield or goggles, which I don't have, but normally you would put that on. Next, you would put on a hair cover. Then you can put shoe covers on. And then lastly, you would put your gloves on. And I'm just putting clean gloves on, but it depends on the procedure you're doing if you need sterile or not. And then you would remove your PPE. You take the gloves off first because they're always the most contaminated. So you pull downward, and then your next one, grab by the top and pull downward and fold around the other glove. Then you would remove the gown. So to do this, you release your ties, so you can just pull to break them. And then next you would slip your hands inside the neck and pull the PPE down. And then reach inside where it's clean and not contaminated and pull your arms out and slowly fold the whole PPE together so that the inside is now facing outward. And you would throw this away after. Next, you would remove the goggles. Then you can remove the mask. You take the lower ties off first, and then the upper ties. And you should never touch the front of your mask because that's contaminated also. Then you take off your hair covering and your shoe covers. And then you should always wash your hands after. Okay, the next skill that I'm going to demonstrate is how to move a client from their bed to a chair. So first you would identify the client and make sure you have the right person. So can you please state your name and date of birth?
Daniel Carpenter, 6/21/92.
Okay. And then you would check to make sure that the bed is locked so that when you move the client it doesn't slide. And then I'm just going to place the chair at the head of the bed, close to the client. The chair should be facing on an angle to the client, so it's easier to get to. And you should always make sure these wheels are locked as well. Next, you move the client to the edge of the bed and instruct them to bend their knees and turn on their side, and to keep their knees bent while they turn. So can you just turn this way for me and bend your knees? Okay, good. And then you should always remember to use good body mechanics. You should always bend at your knees and hips and ankles. Try not to use your back too much. Okay, next I'm going to place one arm under the client's shoulders and then the other underneath of her knees, and then have her push off of the bed with her arms. So just push up with your arms. Okay. So now that she's in a sitting position, we're just going to leave her here and let her dangle for a little while with her feet on the floor. This helps for people who are laying for a long period of time. If the client is feeling stable, you can proceed. If not, you should take their vital signs just to make sure that their blood pressure is okay. Next, you would use a gait belt, and you would wrap this around the client's waist. It just gives you something to grab onto and hold for support. So now I'm going to move Danielle to the chair. So I'm going to place my foot that's closest to the chair in between her feet. And I'm going to bend at my knees and my hips. And we're going to rock back and forth. So 1, 2, 3. Okay, so I'm going to hold on to the gait belt and I'm going to pivot her slowly to the chair. So we're going to go rock back and forth, kind of. And then I'm slowly going to lower her to the chair. And then once she's in the chair, I could assist her to the most comfortable position. I could give her extra pillows or help her elevate her legs.